Now the next speaker is Professor Claes Feinbaum from Israel. He is a character. We know him from the beginning of Presbymania. He had also worked in South Africa, in Natal, in the university there, a number of years. He may like to tell you. His topic has changed. He is now going to speak about the patient selection for presbyopia treatment. Claes.
Thank you very much. Good morning, everybody. Nice to see that you are so bright and fresh in the morning. And thanks for the kind words. We thought we would change a little bit to get a natural flow from what Jerome said, so I swapped a little bit around with the subjects. And what we have to ask ourselves today is, of course, what is functional vision? And to contradict a little bit, to cause a stir, Snellen does not really take into account the real world. Because if you look at this slide and at this slide, they are both, if the optometrist or ophthalmologist measure their visual outcomes, it will give you a 20/20 or 1.0, but with different qualities. So what we really can say is that Snellen visual acuity is not quite the same as functional vision, as you can well see on this slide, and this demonstrates very well what I said of 20/20 vision clear and 20/20 vision blurred. So in my humble experience, good candidates for presbyopic refractive surgery have a strong desire to achieve excellent distance, intermediate, and near vision without the need of specs. In the healthy eye, accommodation is aided by increased depth of focus through uncorrected astigmatism, longitudinal chromatic aberration, monochromatic high-order ocular aberrations such as spherical aberration and coma. Now this is in the healthy eye, please note. Age 60 and above, and they still can probably see a little bit of here. Why is that? That is due to age-related changes in the pupil size, which is decreased, i.e. increase of depth of focus, and spherical aberration, which is increased due to changes in the shape of the crystalline lens. So we've made impressive improvement on our refractive surgery. In the around 2007-2008, we thought about at year 2010 we will have 20/20 vision, that is to say supervision. But there is a but. It is very clear that supervision is not the ultimate correction anymore. Because they will have such a small depth of focus that even a mid-distance target will require an accommodative response in order to achieve an optimal retinal image. So, when we choose our patients, we need to take into account the following: have a history of excessive complaints regarding their glasses or contact lenses, drive at night as a profession, are happy wearing glasses, have pre-existing unrealistic expectations of visual improvement, problems with nighttime glare, and have pre-existing significant ocular surface disease, that is to say, dry eyes. Patients must be able to adapt to glare and halos. This is the biggest problem we have, either if you do refractive surgery, presbyopia, or implant multifocal, trifocal lens, or what have you not. They have to be able to adapt to glare and halos. Astigmatism, another fact for you. Now, watch out, because even a little bit more than half a diopter of astigmatism will certainly decrease the vision outcome and the vision quality of that patient. And this you will recognize, the immediate post-operative healing and the effect of visual acuity. You've heard this many times. Doc, I don't think this really worked. I don't see so well. So what this in fact means is that you are required to have more chair time to explain to these patients that hopefully, pray God, it will be better in the future or in a couple of weeks. Now, of importance for the vision quality, you have to bear in mind the ocular surface of these patients. They are 45, 50, many of them can have or will have a dry eye syndrome. Whether it's regarding volume or it's regarding quality, it doesn't matter. If you don't have a good system, the outcome will not be that good. Sorry. Neuro-adaptation takes about 2 to 6 months, and age, as a matter of fact, is not a determining factor. And again, as I stated before, chair time is necessary. Neuro-adaptation, you all know about. This you might probably not know about. Neurogenesis is an adaptive roles in learning and in memory, changing of environments, depression and moods. This is also a very important factor when you choose your patients for surgery. Monocular and binocular changes will absolutely take place, and this is again visual adaptation to these new methods or ways of seeing. The patient profile, if you have a patient wearing bifocal spectacle lenses, this is not a very good patient for presbyopic refractive surgery or whatnot, because they are so used to have two sharp images, one for near and one for distance. For example, we take, and here we have an excellent example in the world of optics. You remember all the Franklin bifocal lens, where he had the executive bifocal lens. The lens is built on that, and it has been quite a successful IOL for patients. Spherical aberrations we need to take into account as well, of course. Now, there are psychology in all this. Sorry, it's the willpower. Will it work? I want it to work. I don't really care. Now, if you have a patient that wants it to work, that is going to be a successful patient, because it's simply up here in the brain. If they are a little bit skeptical, you have to work more on these patients, and it might not be as successful as you want. So natural vision is related to a great degree to the environment that we work in. And here is a list of all the different distances that we work at, from 30 centimeters up to far. It's up to you to tailor-make the visual requirements for that patient. So customize is the right word. I give you some take-home messages. Consideration for choosing a refractive surgical procedure include patient preferences and patient age. Guidelines should never be binding, nor retain your ability to think further. Use your imagination. Patients may be more forthcoming about their expectations, and phrase your explanations properly. Reinforce the potential limitations, and focus on two elements: vision quality and vision performance. Thank you so much for your kind attention.